Hey, good afternoon, recovery community. My name is Ryan Fowler, and I'm the harm reduction coordinator here at what is currently the Claremont Exchange. Typically, our needle exchange program operates at Valley Regional Hospital in Claremont on Thursdays, but because of the COVID-19 pandemic and shutting down of services, we are now currently operating fully mobile syringe services program in both Sullivan and Grafton County. So what you're seeing here is the local needle exchange. We have made some adaptations to ensure that people who use drugs in the community are safe and protecting themselves from the spread of the COVID-19 virus. So as you can see here, we have 5 different sizes of syringes for folks. We have sharps containers, collecting plenty of used syringes here, getting the used stuff off of the streets. We're providing participants with things like personal protective equipment, gloves and face masks. We're also offering people some sanitation equipment, personal hygiene products to stay safe and clean. Offering things like alcohol prep pads, not just for injection, but for services. So if somebody smokes out of a pipe or something like that, they can sanitize with these that are 70% alcohol. These are ideal to kill germs. We're also offering mouthpieces for people who smoke their drugs, because right now there's a lot of communicable germs out there, and so we're trying to get people to use mouthpieces if they're going to be smoking their drugs. We're also offering as much Narcan as people are willing to take right now, because as systems shut down, people are still going to use drugs, and people are still at risk for overdose, and so we're trying to get as much of this out as possible, as well as CPR shields, so that in the event that somebody overdoses, giving them mouth-to-mouth resuscitation or rescue breaths is going to give their body oxygen and prevent anoxic brain injuries, and also keep them alive during an overdose event. And if somebody does not have naloxone on hand, performing rescue breaths is going to save their life. So we're trying to get CPR masks out there. While we have it, we are giving out hand sanitizer, encouraging our participants to stay safe while they're out there, stay hygienic, and also getting people to wear Band-Aids, because if you have an open wound on your hands or arms or anywhere, you're at a higher risk for contracting disease. So we're out here just really trying to make sure people have what they need to stay safe. All sorts of sterile injection equipment, as well as healthcare stuff, tissues, cough drops, all this stuff. Really anything that people have asked for, I've tried to provide right now, because people are having a hard time getting what it is they need. You know, there's millions of people right now in America who are living with a substance use disorder, and that disorder is characterized by continuing to use drugs despite negative consequences. And so despite whatever negative consequences might be in the face of people who use drugs, there are millions of Americans who will continue to use. And what we're seeing as we shut down imports and exports because of the COVID-19 pandemic, drug supplies are changing very quickly. It's becoming harder and harder to get methamphetamine and fentanyl, and the fear is that there will be new novel compounds that will emerge, oftentimes that are more dangerous than fentanyl or methamphetamine. And so people need to be knowing what it is they're using, and if they're using a new supply, please practice harm reduction. Please don't use alone, drink plenty of water, stay safe, carry naloxone, no rescue breaths. And, with harm reduction, all drug-related death is preventable. Never Use Alone is a really great resource online. And really just knowing that a lot of people who use opiates are going to go into withdrawal during the next few months. There's going to be less and less opiates available. And so we really need to make sure that our friends in medication-assisted recovery are ensuring access to Suboxone or buprenorphine and methadone, so that when people are going through opiate withdrawal, they have access to evidence-based treatment. Please ensure that your provider knows that they are able to give you extra take-homes, because SAMHSA has loosened restrictions on agonist therapies for opioid use disorder. And so there's no reason for folks to be going to the methadone clinic every day. You should be getting 14 or 28 days worth of take-homes. If people want to initiate or engage with a Suboxone provider, they can utilize telehealth right now. This virus has the ability to kill people. It has the ability to really disrupt systems for a long period of time. And just be out there loving one another, supporting one another, being there for each other right now during this really difficult time. And if you're listening to this and you're kicking the tires of recovery, or you're wondering what does this look like for me, please give me a call. That 603-276-9698 number goes to a phone that I carry at all times. I'd be happy to talk to you, be there as a friend, and connect you with resources. So thank you all for listening.